Level 1 is really what we need to make sure that you're happy with going home from today. Level 2 is when you make things harder, and that's like an athlete. You're going from your marathon athlete with your kind of endurance muscles. So what I usually say is level 1 is the exercises that will let you leave the house. So they're the exercises that let you go from A to B without worrying about having some leaking. Level 2 is your sprint runner. So they're the quick switch. That's when you're turning it on. It's not a dimmer switch anymore. It's a light switch, okay? And that's what the muscles that kick in if you go to cough. I don't know if you find when you're coughing or if you go to do a sudden movement, if something falls and you go to reach for it suddenly, that you might get some kind of leakage, okay? It doesn't happen to everyone, but I'm saying that some men find it, and that's what level 2 focuses on. So level 2 is basically turn it on quickly, hold it for as long as you can, turn it off. If you can't do level 1, it's very unlikely that you'll be able to do level 2 because you're supposed to find that muscle even quicker. If level 1 is becoming easy, you can try some level 2, which is basically where you don't do your slow ramp, you switch it on, you switch it off, and you do that quickly. So you can add in some of those exercises at the end, okay? And again, it's just making sure that those fast twitch fibers are able to kick in when you have less notice, when you're giving your muscles less notice for what you wanted to do, okay? The level 1 and the level 2 are the base. We progress patients on to exercises that maybe challenge you a little bit more. And one of the most popular ones that you may have seen is the Turkish get-up, which is this exercise, where you hold something above your head when you're lying on the floor. You don't look impressed with this one. And it doesn't have to be it doesn't have to be a kettlebell. A lot of my men just hold a bottle of water. Okay? So they lie on the floor, they hold their bottle of water, and then they get up from the lying position with their bottle of water held above their head the entire time until they're standing. And then I say, now, would you mind coming back down onto the floor again? The focus of the exercise is not the getting up and getting back down again. It's that the entire way through that exercise, you feel that there's tightening there and there's no leaking when you're doing it. Okay?
What's it called?
It's called the Turkish get-up. They use it for a lot of gym programs, for athletes, but it's especially useful for issues to do with the pelvic floor because you're putting your body through so much movement right from the floor up to standing and back down again. And it's all about, can I keep that muscle lifted when I'm doing it? Can I keep that muscle contracted? And can I minimize the amount? The leaking mightn't be gone, but can I minimize the amount of leaking that happens when I'm doing that exercise? Okay? I put it up because people say, oh, she never talked about that exercise because it's popular. I am talking about it, but I'm saying that's not for today. That's not for next week. It mightn't even be for next month. But you do level 1 and level 2, and then whenever you feel able, you go on and you do things like that. And I want to emphasize at this part, every man is different. You could do it next week. You could do it next month. It depends on, did you have bladder issues before your surgery? Some people do. How was your surgery? Did they affect the nerve a lot, or was it nerve sparing? Because that'll decide on this. Or things like, are you carrying excess body weight? That might make it harder. So sometimes I'm just trying to get across, it's not you. You need to train up the muscle the best you can. And then hopefully we'll be progressing onto this within a matter of time, but it's not the same for everyone. All right? I've finished with the kind of the muscle, the exercises and how we prescribe them and what we ask people to do. But I felt like I couldn't finish up today without talking about tightening the tap. So these are the other, I would never just give exercises to someone without discussing tightening the tap, okay? And tightening the tap are day-to-day cues or other kind of things that you can do for your body that will help with continence as well. And they include habit, okay? Examining the habit. You know, the minute I feel I need to go to the toilet, am I running to the toilet? That way, my bladder never gets used to being full again. Okay, so you have your catheter after surgery, the bladder doesn't have to fill, and sometimes it gets used to not filling. So the minute you feel, I need to go to the toilet, you're rushing to the toilet. Can we break that habit? I know you need to go to the toilet, but maybe we could walk into the kitchen, fill up the kettle, and then go to the toilet. So you're trying to break the habit, you're trying to make the bladder wait a little while. Okay, delay it a little bit. And I know that this might lead to some issues at the start, and if you're wearing pads, it might mean that your pads get wet, but it's just about retraining. It's a muscle program, and you're trying to retrain that bladder that it doesn't have to go to the toilet straight away. Okay? The next one is sensitivity. So this is, I feel like I need to go to the toilet, and I must go straight away again. But in this case, it's you might have only had one glass of water and you feel like you need to go to the toilet. So when they talk about sensitivity, they say, you know, have you had anything to drink since the last time you went to the toilet? If you haven't, you could probably wait a while. Okay? So it's about, again, these kind of I know you talked about distraction earlier. You know, he was talking and I was listening to him, and then suddenly I realised, oh, I haven't gone to the toilet in a while. It's a tool to be used with the Kegel exercises. The next one is brain training. And this is what they talk about. I need to go to the toilet. I'm going to sit here. I'm going to do 30 of my Kegel exercises, and then I'm going to go. So the brain actually retrains, contract, try and help the bladder, then go to the toilet. Or the other thing that people do is they do 100 toe crunches or toe curls. You know, they curl their toes up and down 100 times. It distracts the brain focuses on that, and then you go to the toilet. And the kind of the thought behind it is each time you do one of these tricks that you're waiting longer to go to the toilet and that you're leaking less, if that's a problem for you. And the last one is bladder training. The man who taught me all of my knowledge in this area said you can't manage what you don't measure. And he's big into bladder training. It's not for everybody. So this would mean that you weigh your pads. How much have I leaked today? Can I leak less next week? For some people, that's not a problem. For other people, it's, should I measure how much I'm going to the toilet so that I'll know, okay, I'm actually getting more, when I'm going to the toilet, I'm peeing more and leaking less. And that's bladder training. So it is done. You know, they weigh their pads, they measure what they do going into the toilet. Again, it's not for everybody. Some people won't have the issues around leaking and it won't play as big a part of their day-to-day lives. But I wanted to mention it in case you need any more information on it. And it is done, and it is used as a kind of a management strategy for some men if they're trying to think, how am I doing? Am I getting better with this?